I am so sorry that we had a technical glitch and earlier video didn't go live and my voice was echoing. So we are joining with Dr. Kajal and we are talking about PCOS. This is the second episode of the continuation of the series Holistic Healing of the Mother. And Dr. Kajal will be joining us live from India. And she's going to talk about PCOS. She is a homeopathic expert and has done masters in homeopathy, and she has a wide experience in helping out um, people having. So I'm going to invite her and let's see if the echoing goes off.
Off.
No, I can still hear
No,
my
I can
voice.
still hear my voice.
My voice will be
My voice
limited,
will be
so I'll ask
limited, so I'll ask uh,
one or two questions
one or
and
two
then I'll
questions
give
and
it
then
to
I'll
you.
give
The
it to you.
platform to you,
The
Dr.
platform
Kajal.
to you,
Sound
Dr.
good?
Kajal. Sound good?
Sure, no
Okay,
issue.
okay.
Okay, okay.
So I
So
hope our
I
audience
hope our
already
audience
knows
already
about
knows
Dr.
about
Kajal, that
Dr.
she's a
Kajal, that she's
homeopathic
a homeopathic
expert.
expert.
And Dr.
And
Kajal,
Dr. Kajal,
there are so
there
many
are
myths
so many myths
around PCOS.
around PCOS.
Let's talk about
Right.
them.
Let's talk about them.
Sure, why not? Um, Firstly, I want to clear things about what is PCOS and when do we label somebody as PCOS. The reason I want to begin our talk with this is every month I get a lot of women who themselves come with just one sonography report, which says that the sonography says that it is polycystic ovaries, and they self-claim, okay, that they have got PCOS. So they have not been diagnosed with a doctor and they start living in that anxiety that, oh my God, I have PCOS and now it is incurable. I won't be able to conceive. So, my dear friends, just having polycystic ovaries on sonography is not the only criteria to label you as PCOS. You have to fulfill at least two of the three criterias to call yourself as PCOS, and they are as follows. Firstly, there will be high level of male hormone in the body, that is the androgen levels would be high. So that leads to certain problems like excessive hair growth. There will be acne, there will be pigmentation or darkening of the skin, mainly on the back of the neck, on the private parts, etc. And secondly, you will face some kind of problems with your periods. They may be irregular, or you may not get them at all, or they may be, very profuse in quantity, a lot in quantity, or having irregular periods, you're bleeding quite frequent, or it is quite delayed, the dates are quite delayed. So these are the two things. And third is sonography. So you have to fulfill at least two of these three to call yourself as PCOS. So this thing is very important, because whenever you go for a routine checkup and you just see that, okay, on sonography you have polycystic ovaries, and oh my God, am I PCOS now? Will I not be able to conceive? So don't live in those fears. Firstly, get yourself diagnosed with a medical expert. Let them tell you that is it really PCOS or is it PCOD, and then we talk about the treatment. Whenever we talk about the treatment also, that differs patient to patient. But yes, coming back to myths now regarding what Dr. Shweta was talking. So talking about the biggest myth that revolves around people commonly is about having PCOS and having inability to conceive. This is a biggest myth, and we all need to understand firstly that PCOS is a multifactorial disease, which
Yeah.
means that there is no one direct cause related to the disease. There are multiple factors involved. So
True.
whenever we have a disease like this where the problem is at multiple level, so the treatment also has to be directed at different levels. Now, having PCOS and having infertility often goes hand in hand. The studies have shown that often 60 to 70% of women who have got PCOS suffer from difficulties in conceiving. I will not label them as infertility, because they can eventually conceive with the correct treatment and the correct measures taken. So I think a more appropriate term here would be facing difficulty to conceive. Now, let me explain our viewers a little bit about why do they face difficulty in conceiving. We need to understand firstly that PCOS is a disorder of the endocrine system. So, in our body, we have our hypothalamus, we have our pituitary gland, we have ovaries. Now, all of these glands, they secrete certain hormones which may be very, very small in quantity, maybe just a few ml, but they are extremely crucial in our overall growth, development, as well as functioning of the body. Whenever there is any kind of disruption in these hormones, it leads to various kind of diseases. Now, when we talk about PCOS, PCOS is a condition where in a female's body, there are more of male hormones rather than the female hormones. So that is PCOS. Now, because of this happening in the body, it hampers the ovarian function.
Right.
Now, we might know, a lot of our viewers might be knowing that our ovaries contain a lot of small follicles, which are medically called as eggs. They help, they get mature there, and at the appropriate time, when the maturity is over, the eggs are released. When the egg is released, it meets the sperm, and that leads to conceiving, right? Now, the problem in PCOS is because of the hormones, because of the imbalance of hormones, this maturation of the egg does not occur at all, or it may be delayed than the regular time required.
Right.
So now, because the maturation is delayed, the release of egg, either it may not happen at all, or that might as well be delayed. So that is why either some of the women get no periods at all, or they may be irregular periods. Now, this is the major problem of facing difficulties in conceiving. So, as we understand that this is pure a hormonal thing. So, why I call it hormonal? Because there is no structural abnormality in the body.
Right.
What I mean by this is the entire reproductive system of the woman, that is not at fault, right? So
Right.
structurally, there is no damage or no fault of the system. So in a way, that is good, because when we have that, the treatment options are quite limited. So hormonal disorders are like, functional disorders. So managing them is relatively more easy as compared to managing the structure when it comes to. So definitely people suffering from PCOS, they can surely conceive if they take the correct treatment, the correct measures. There are often studies, research studies, that are recommending that even just a 10% loss in the body weight helps immensely in conceiving. We often find that PCOS women are, obese, they are overweight, and that in itself causes a lot of hormonal problems, and also invites a lot of co-sisters of PCOS, such as insulin resistance, which will cause type 2 diabetes mellitus. It will cause irregular cholesterol levels. It will cause thyroid disorders. So PCOS can also lead to other of its co-sisters. So treating PCOS is not only important because you want to conceive and therefore you should get treated, but for your overall health also, treating PCOS is extremely important. So I think the takeaway for today, the biggest takeaway from our talk would be that definitely women suffering from PCOS can get pregnant.
That is, thank you so much for giving and sharing your wisdom, Dr. Kajal. So there's also one question that floats around in the social media. Is there a difference between PCOD or PCOS?
Right, and I think this is an extremely important question. So, so far what I have discussed was all about PCOS. PCOS is a disorder of an endocrine system. So, it is because it is a syndrome. Now, medically, whenever we label a disease as a syndrome, which means it's a wide spectrum, and women can lie anywhere in this wide spectrum. So, so just like any other disease, which is ranged from mild, moderate, severe.
Right.
So similarly, PCOS, because it is a syndrome, it does not mean that every woman will have all the symptoms or the same set of symptoms. You can have any set of symptoms in varied permutations and combinations.
Very important.
So that is PCOS. PCOS is definitely, I would call it more serious than PCOD
Mm-hmm.
because the PCOS can manifest at various levels. Like as I was saying, in terms of reproductive health, it can cause with failure or delayed in conceiving, or it can cause diabetes, mellitus, thyroid problems, and a lot of such complaints. So, conceiving is a challenge more in PCOS as compared to PCOD. And even after conceiving, a woman may face a lot of health issues during pregnancy and even at the time of delivery. So, being aware of those high risk group and being able to tackle them at every milestone is extremely important. Whereas, on the other hand, when we talk about PCOD, that is polycystic ovarian disease, that is also a condition which occurs because of imbalance of the hormones, but this variety is more common than the syndrome, that is the PCOS.
Mm-hmm.
Even here, the imbalance of hormones will present itself in the form of irregular periods, delayed release of eggs, and even cysts. But when it comes to conceiving, women do not face much problems here. Conception is more of a problem when it comes to PCOS rather than PCOD. So PCOD, in a layman's term, maybe I can say that this is more of a disease which is limited only to the reproductive system,
Mm-hmm.
whereas PCOS is more flared, where it can involve any system of the body, or rather, it does involve many systems of the body.
Very, very important point
Very
that you
important
brought
point
up,
that you
Dr.
brought
Kajal.
up, Dr. Kajal.
There is a difference
There is
between
a difference between
PCOD and
PCOD and PCOS.
My
My
next question would be,
next question would be,
what are the tricks
what are the
in homeopathy
tricks in
that you would like
homeopathy
to
that you
share
would like to
that
share
can help
that can help
patient with
patients
PCOS
with
in
PCOS
resolving those
and resolving those
symptoms?
symptoms?
Sorry, could you please repeat? I think I couldn't hear you clear.
Like, how does
Like, how
homeopathy
does
help
homeopathy help
in a
Right.
patient
in a
diagnosed with
patient diagnosed
PCOS?
with PCOS?
Okay, right. So, PCOS is the disease of the new era of the new generation. We have not encountered a lot of these cases in the previous generations, and day by day we are seeing an increase in the cases. Definitely, all over the world. It's not just limited to India. I'm sure Dr. Shweta there at Canada also
Oh,
faces the
yes.
same
Oh yes.
thing, right? So, sorry. So, whenever we talk about any conventional treatment for PCOS, which may include certain kind of hormonal treatments or surgeries, so they have a lot of side effects associated with them. And the bigger problem and side effect is the rate of recurrence, which is as high as 90%. So instead of that, I want to tell our viewers regarding the other options that are available for treatment, such as homeopathy and the other Ayush systems of medicine. So today I will like to elaborate a bit about how homeopathy can help for PCOS. So with the help of homeopathic medicine, we can restore and we can balance the hormones of the body, which have taken a toss because of the excess of male hormones. Since it is a disorder of the imbalance in hormones, correcting hormones is extremely crucial, and homeopathic medicines can do that because the seat of action of homeopathic medicines are also on the hypothalamus, on the pituitary, and on the ovaries. So there are a lot of effective homeopathic medicines that are available for the same. However, it's not the ball game is not end only by giving pills to women. There are a lot of other factors also which needs to be considerable, such as having a good nutrition, having regular exercise, weight loss is extremely essential, and so these things cannot be given in terms of pills. So our viewers and women who suffer from PCOS need to understand this aspect extremely important, that because the disease is multifactorial, we need to work out also at various levels. This is not like any other disease where you can just take pills and expect to get cured of the disease.
True.
And
True.
yeah, so there are a lot of researches done in homeopathy, which is proven to be very effective for PCOS. The ultimate goal of homeopathy is not just to induce menses or to just help you to conceive, but it helps at the root cause of PCOS, which is the hormonal imbalance. often I have seen that women who suffer from PCOS, they are often given birth control pills,
Yes.
which are also a type of hormonal treatment given, which is quite effective, I agree. But the problem is the moment you stop those pills, you are back to square one, because this is just a partial treatment, or I would say a temporary treatment, because this does not touch the root cause at all. The root cause is totally different. The root cause is all about hormones, and giving external hormones will definitely help you only for a temporary period of time. So we need to understand that we need to work at the root cause, and homeopathy does this very well. The best thing about choosing homeopathy would be because it is safe, it is effective, it has no side effects as per the researchers done, and also homeopathic medicines never make you dependent, which means that after having a proper course of homeopathy, you need not take the medicines forever. So even when you stop the homeopathic medicine after your course is done, which is a very important statement, so your cycles, your periods will not be dependent on the medicine. They would come as natural as they were before you got PCOS. That is the most important thing in PCOS, and that is what homeopathy works at.
This is such an
This is
important
such an
information.
important information.
Thank you so much,
Thank you so much,
Dr. Kajal, for
Dr.
sharing
Kajal,
this.
for sharing this.
Before we wrap up
Before
this
we wrap
session,
up this session,
any
any
last tip
last tip
for our viewers
for our viewers
to help
to
them in
help
this
them
journey?
in this
Like
journey?
where should
Like
they
where
start
should
from?
we start from?
What are the next
What
steps
are the
for a
next
person
steps for a
diagnosed
person
as
diagnosed
PCOS?
as PCOS?
Or what should be the next?
What should be the next?
How should they
How
start?
should they start?
Right. I think this is the most important step, Dr. Sweta, because the moment they get to know that they have PCOS, they get a lot of anxiety, a lot of questions, a lot of fear among their peers that, oh my God, what is going to happen next? Am I going to be medicine dependent and whatnot? So the first step is, as I even began my talk, firstly, you need to get yourself diagnosed from a medical expert and not from Google or from any WhatsApp messages or forwards. That is extremely important. First, label yourself that are you really PCOS, PCOD, or any other disease. Just having irregular periods is not PCOS. There are n number of medical reasons for you to get them. So yes, first step is definitely to get diagnosed. Second step, and the most important step, I think, would be for you to for the person to get diagnosed, is to do a small research and to make up your mind that what kind of treatment would you like to go ahead with, whether you want to go ahead with the modern treatment, with the Ayush system of medicine, or with anything else also that is available in the market, knowing the pros and cons of each treatment as per the research, and not about what some article you read or some WhatsApp message or on Google. So having a thorough knowledge of that is extremely essential. Also, because PCOS is multifactorial, so not only getting a help from a doctor from modern medicine or a homeopathic practitioner or an Ayurvedic practitioner, you have to of course do any one of all of these, or you may do them together because they all work at different level. So you can have an integrated approach as well for PCOS, which works really very good, and it does not have any side effects because the medicines never interfere, because the way of action of medicine in each of these different systems is quite different. But along with these, ये तो मतलब आप करेंगे ही. These are the things that you will do and you have to do. But besides this, focusing on your nutrition level, focusing on your weight management, on your stress levels, focusing on your life habits such as alcohol, smoking, all these things also will eventually play a very crucial role to you to overcome PCOS.
Wow.
And yes, one last point, Dr. Shweta, that I forgot to add is regarding self-medication.
Yes.
Dear people, please do not self-medicate. Just because somebody else has got better with a particular set of medicines, that does not mean that you will also get better with the same. we need to understand that PCOS is polycystic ovarian syndrome. It is a syndrome, and you can lie anywhere in this syndrome. Okay, there's a wide range of the spectrum. So the treatment, the dosages, the repetition, they all differ from individual to individual. So having a customized treatment and an individualized approach is extremely important. So just because you have seen a video on YouTube or something on Instagram that, okay, this medicine helps, that does not mean that it is going to help you as well. You need to always ask the medical expert before starting that treatment.
Thank you. Thank you so much,
Thank you
Dr.
so
Kajal.
much, Dr. Kajal.
I come up with
I
so
come
many
up with so many
patients who
patients
try to
who try
self-medicate.
to
This is such an
self-medicate. This is
important
such an
message
important message
that we
Right.
got to
that we
reinforce
got to reinforce
with our
with our
audiences or
audiences
with the
or
help of this
with the
platform.
help of this platform.
My voice is
My
echoing, so
voice
I'm
is
going
active,
to
so I'm
upper
going
the
to
session soon.
session soon.
I wish a
I
very
wish
happy
a
Mother's
very
Day
happy Mother's Day
to all the mothers
to all the
today.
mothers today.
May you be mothers
May you be
today,
mothers
just
today,
like you are
just like
mother to
you are
others.
mother to others.
So make
So
this
make
day
this
memorable
day
for the
memorable
mothers.
for the mothers.
My humble
My
request
humble
to all our
request
viewers.
to
And we will be joining with another expert next week at same time. Thank you so much. Dr. Kajal.
Dr. Kajal.
Thank you so much, Dr.
Thank you
Kajal.
so much, Dr. Kajal.
Thank you so much, Dr. Shweta, for inviting me on this special day, and choosing this topic on this day was extremely, I think, important for our future PCOS moms. So I hope this session was useful to everyone. And thank you again, Dr. Shweta, and wishing everyone a very happy Women's Day.
Thank you.